The information shared in this episode is not intended to serve as a substitute for mental health services and is only intended to provide education and information to you, the listener. Today, I have the good fortune of sharing space with Dr. Anna Olivares, who will discuss the typical psychological state of a child whose parent is facing deportation from the United States. First, let's get to know more about our guest. Dr. Anna Olivares is a licensed clinical psychologist who practices in Las Vegas, Nevada. A native of Los Angeles, she received a bachelor's degree in psychology from California State University, Los Angeles, and her doctoral degree from the Chicago School of Professional Psychology in Los Angeles, California, her hometown. She completed her training in Las Vegas as one of 2 interns for the Nevada Psychological Association Training Consortium at a private practice specializing in the treatment of eating disorders, and she became licensed in 2016. Although Dr. Olivares specializes in treating eating disorders, her passion for working with the Hispanic community sparked a special interest in her to explore other areas in which her psychological skills could be utilized and strengthened. Over 50% of her private practice is devoted to providing psychological services in the form of comprehensive evaluations for individuals who have current undocumented status and are in the process of applying for lawful stay in the U.S. Dr. Olivares has received specialized training in the evaluation and research of this particular population. This population has a unique psychological journey through feelings of shame, guilt, loss, and resilience. Based on the most recent research, this group in particular are highly vulnerable to experiencing significant psychological harm as a result of deportation or removal of a parent or spouse. The context of this conversation will primarily focus on the experience of a child whose parent is facing deportation, the symptoms that the child can display psychologically, emotionally, and behaviorally, as well as other significant matters related to this overall experience. Without further ado, let's get into it. Dr. O, thank you so much for joining the Honeybee podcast. How are you doing today?
I'm well, thank you. Thank you for having me.
Oh, it's my absolute pleasure. I would love for you to share some information about your providing assistance to individuals who are facing immigration proceedings. I think that we're going to have a very dynamic, important, and meaningful conversation. And as we approach that type of energy, please tell us about your role in providing assistance to individuals who are experiencing interface with the immigration proceedings.
Of course. My role as a psychologist in providing these evaluations is providing the reader of the evaluation, whether it's an adjudicator or a judge or an attorney, with a psychological perspective of the individual's current psychological status, their mental health. So the way, people contact me is they are already working with an attorney during their interview process or their application process, for which there's different types of visa applications for undocumented people. They get referred by their attorney to get a psychological evaluation. This is usually indicated by them, the attorneys having information that they maybe are on psychiatric medication or have been hospitalized before, or they've indicated that they are experiencing significant stress or anxiety or depression. due to the current situation of their spouse or a parent going through the immigration process, whether they've been detained or they're, essentially taking the risk to apply to be able to lawfully stay in the United States.
And so, in my knowing that you provide comprehensive psych evaluations to individuals who are experiencing this sort of stress, I get curious about how this level of stress affects not only the person, but also the dynamics of the family. Like, let's say that, if you're typically working with an adult and you are interviewing them to find out how significant their mental health issues are or their emotional stress that they're facing due to the legal proceedings, and knowing that you're working with these sorts of individuals, I would imagine that this sort of stress not only affects the person, but it also affects the individuals who live under the household with them.
Absolutely. A vast majority, I'd say at least 75% of the type of evaluation that I do is called the 601 waiver.
Okay.
And the way this application works is the evaluation is actually conducted with the US citizen or US resident spouse or child that is the one that is having the psychological problems. So the evaluation is not necessarily for the undocumented person.
Mm-hmm.
It is for the qualifying relative. So essentially, the qualifying relative is the one that is likely to suffer extreme hardship should their spouse or parent be deported out of the country.
And would that hardship transcend the financial support that maybe that the undocumented individual provides?
Absolutely. It's not uncommon for, attorneys and, proceeding officials to require the immigrant applicant or the qualifying relative applicant to gather as much information as they can to show not only psychological hardship, but financial hardship. Vast majority of the people that are undocumented do work and they contribute to their household, have been working for many years. A lot of people that come through my doors have been employed for 15, 20 years. And yes, they've been undocumented and working here. Mm-hmm. And some of them are still undocumented, but have a temporary work authorization. So there's different levels of different kinds of situations that come through my door. So all of that information is important to illustrate and to show in the report as background information. Of course, there's other factors that how long this person has been experiencing the psychological problems. Mm-hmm. Is this something that started 2 weeks ago? Is this something that's been going on for the last 6 months? A lot of these applicants, these proceedings take a long time. Someone can apply in June for their qualifying relative and not hear anything from USCIS, which is the Immigration Department, mm-hmm. for 6 to 9 months. And during that time, it's incredibly stressful. There can be, because of the stress and worry that the family individually and as a whole experience, you start to see problems with adjustment. You start to see changes in the relationship between family members. It can even result in, physical changes in sleep, changes in appetite, difficulties at work because, you're not able to concentrate or you're not paying attention well. So all these problems, it's not one thing that happens. It's usually a wide array of consequences and reactions to this specific situation.
So then this specific situation is multifaceted in that it creates stress in so many different areas of an individual's life as well as their family members. And this waiting process, and at the risk of being inaccurate, to the best of my comprehension, this waiting process creates an enormous amount of stress in the household and for the person.
Absolutely.
And they still have to function skillfully and as high functioning as possible across environments, in their relationships, at work. How about at school? You mentioned the 601 waiver that includes you interviewing family members, maybe even the child. And so you and I had a chance to have a conversation before I hit record. And, you and I discussed the effects that deportation and family separation has on the spouse
Mm-hmm.
maybe the parent who lives in the home, as well as the kid. So
Absolutely.
you painted this picture of ICE coming to the home and detaining the parent. And I would like if we can recreate that conversation from your
Absolutely.
experience of interviewing children who have had the experience of watching their parent be detained. Can you please walk us through what that process is like for the kid witnessing this?
Absolutely. This process involves so many factors, and I think you don't have to have a parent picked up by ICE or a parent go to jail to really kind of the experience of grief and loss to resonate. The significant and lasting pain that young children and adolescents experience due to loss of a parent. And this is not even in regards to immigration, just in general. Losing a parent, this is well documented in the research, right? What the loss can do. Even children who have gone through a divorce, there's a lot of research on the psychological effects of children, in their younger years versus children that are older versus people who are adults and their parents separate, and the difficulty that is to deal with and the psychological effects of it. So that's just one part of the grieving process. Less care has been taken, however, to address and acknowledge the trauma that children experience as the result of loss of a parent due to detainment or a parental deportation. There's some research in this area, and they're finding that children with a deported parent were significantly more likely to display externalizing and internalizing problems than children whose parents were not deported or in the process of deportation. When I say displaying externalizing problems, this is, one example of that. It's, let's say, a young boy who's, let's say, 12, who, we start to see in school that maybe he's arguing with teachers more or being defiant or being aggressive even with other students, right? So this increase in stress and trauma can cause a child to these psychological effects to manifest in behavioral ways by externalizing. One example of internalizing might be, a child whose parents have been deported or may be deported, and they're having a difficult time concentrating in school. The grades start slipping, or you notice that they're isolating or withdrawing, not having fun, not engaging with their friends, hanging out in the room more than normal, or even anxiety. Anxiety is actually, I kind of say I don't want to put a number on it, but I'd say a lot of the cases that I see where I interview a child, anxiety and problems with eating and problems with sleep seem to be recurring problems that I see in this population.
Excellent and valid points that you raise about how this sort of stress can affect a child behaviorally and internally. This sort of fear and stress is not something that is invented, right? In the sense of like, oh, well, maybe, this is an imaginary fear. This is a very valid, concrete fear. My parent was detained. I saw them be arrested. I don't know if and when they're coming home. Will I see them again? Will those same people who came to detain my parent also detain me?
Right.
What is going to happen? Valid and understandable fear, which affects, like you
Absolutely.
said, a kid's appetite, their sleep, their overall functioning. How can one successfully operate in life with this level of stress, especially as a child when their brain is not even fully developed to cope with this sort of stuff?
Absolutely. It's definitely, and I mean, you just listed a timeline of how things can go. And each of those is a re traumatization every time. So, like you mentioned, a child who sees their parent get detained, then let's say the parent is allowed to come out on bail, then they have to go to court. Every time the parent engages in anything related to their status, it's re traumatizing to the child. I mean, the family is in a state of crisis here, right? Like the child knows nothing but, being with their parent and their family being together, and the risk that may be abruptly separated,
Mhm.
disrupted, it's incredibly traumatizing for a child. I mean, if we just kind of look at it from a psychological perspective, from the attachment theory perspective, a child's sense of security is rooted in relationships with familiar caregivers, their mom, their
Absolutely.
dad, grandparents, right? Like we know certain cultures, certain families have generations that, live together and care for each other. So just thinking about it in that perspective, the secure base it's a very necessary foundation for developing a child's social and cognitive and emotional regulation skills. that are fundamental throughout life. And you know this, and you teach DBT, and just kind of thinking about it in that way. The physical separation between a parent and a child particularly is when unexpected, as in the case of deportation, when something like this happens abruptly, disrupts the essential secure base, right? So this is what I mean when I say that the family is in a state of crisis, especially children, because of the abruptness and the lack of transparency that this process characterizes.
And so then they've hit their crisis point as a family. And this is not, something that can be extinguished within 24 to 48 hours. Like, this is a long lasting, this can go on for weeks, maybe even months of being at this state.
I'd even throw in their years.
Really?
And when I started doing these evaluations, I kind of, maybe it was an assumption that I made that the cases would be similar, that there'd be like similar things going on. And I mean, I've done, over 100 of these cases in the last year and a half, and every person that comes through has just such a unique sense of experience. Mm-hmm. And I don't know what to expect, when I meet with these families, and it's incredibly challenging, I think, even for a psychologist to kind of sit in my chair and look at it in an objective way, right? My role is to look at it as an objective way, but I'm a person too. I'm a mother, and I'm also a psychologist, and I can be empathic and build the rapport with this person who's having this psychological problem who, 9 out of 10 times, they've never seen a therapist or a counselor.
Right.
They've never addressed these issues before. The person that I talk to is a person who's trying to be strong for their family. And so, trying to help them allow themselves to feel and to express when they've never met me, when they've talked to me for 20 minutes, is challenging and it's hard. But it's definitely rewarding when I can give this information, this accurate information via a psychological perspective.
And so, at the risk of raising a few eyebrows, I feel safe enough and bold enough to say that in the media, there may be a lot of inaccurate information, biased information, judgmental and critical information about individuals who are undocumented citizens. Is that mm-hmm. fair? Okay. So then to that end, in the type of stress that the individual is experiencing while going through these proceedings, as well as the family members, like the spouse and the children, I would imagine that it would feel unsettling and maybe even unsafe for the person who is vicariously or not even vicariously, directly experiencing trauma from this sort of issue. I would imagine that they may feel a limited amount of support. Like, I can't talk to my friends on the playground about this. I can't talk to my neighbors about this because there may be some inherent shame due to some of the misconceptions that are out there about the individuals who are experiencing immigration proceedings or interface with ICS. Okay. All right. I said that. Please tune in to the next episode of the Honeybee Podcast, where Dr. O will give us the answer on meaningful ways that we can support a child experiencing psychological and emotional pain as a result of their parent facing deportation from the United States. As always, I'm sincerely appreciative for you tuning in to the Honeybee Podcast. Until next time, peace.